The ventricles of the heart are essential for pumping out blood to the rest of the body. When these ventricles can't fully fill with blood between each beat, it can affect your entire body.
We've actually learned that preserved ejection fraction is more common than initially thought. It seems to occur as people age. It seems to occur more in women than in men, and it can be due to hypertension. So it's more common than initially thought, and it's probably about 35 to 45% of the heart failure patients.
Your ejection fraction is the percentage of blood that gets squeezed out with each heartbeat. Normally, a healthy ejection fraction is between 50 and 70%. This helps make sure enough blood is getting to all the organs throughout the body. It's more common for people with heart failure to have reduced ejection fraction, meaning a low percentage of blood is leaving the ventricle. In someone with preserved ejection fraction, they may appear to have a normal ejection fraction, but the blood flow is still low.
Heart failure with preserved ejection fraction can also be called diastolic dysfunction. That's where the heart muscle does not relax properly, so it does not fill fully with blood, and therefore with the next squeeze, it cannot squeeze out enough blood to maintain the appropriate cardiac output or forward flow.
Often, this is because the walls of the ventricles have stiffened and enlarged. That means there's less space for incoming blood.
Treatment is going to be the medications to address blood pressure and extra volume, extra water in the patient. It's going to be avoiding salty foods. It's going to be having exercise on a regular basis because walking is very important, getting adequate rest, and avoiding things that we know are bad like cigarettes and alcohol. We actually have some excellent medications, excellent mechanical approaches, excellent electro approaches, excellent surgical approaches, and I think that the prognosis of heart failure is much better today than it was back when I was in medical school.